Hello there. I am back and I am doing a 3-week post-op follow-up on my, I forgot the name again. Okay, let me look on the, okay, I have my paper here, but apparently it doesn't tell the name of my surgery, so let me think for a minute. It's called an anterior cervical discectomy with fusion. Yes, I got it. Okay, so this is a surgery I had. I'm 3 weeks out. And the reason I had to have it was, I got my paper here that I'm going to read. I had a large herniated disc at 6-7, which was causing foraminal narrowing. And it goes on with big words, so I'm not even going to attempt that. And then I also had a severe herniated disc at C5-6 as well. I want to backtrack a little bit, tell you a bit about my history as to what led up to the surgery. And then I also made a list to cover some things because while I was researching about my surgery and hearing people's testimonies, there's a few things that I came across that wasn't covered, so I thought I would share so that I can put a little more information out there as well. So first off, I had a car accident about 3 years ago where I was in severe pain on the left side. And the pain radiated down my arm to my fingers, and a couple days later went down my hip and down my leg. This pain was pretty bad. It was on a scale from 1 to 10. I would give it a 7-8, and I went to chiropractic care and massage therapy and stretching at home therapy, and eventually the pain subsided. However, then some more similar pain set in, which my doctor thought was, carpal tunnel. So I was tested for that, and then I was taking some neurological meds. That didn't let up, and oh, my hair's wavy right here. Okay, so I'm gonna cover that up. So that didn't let up, and the pain just got worse and worse. I was trying the braces, I was trying the meds, I was trying the treatments and home care and the stretches with the arms and then one day I woke up and it felt as though I had slept on my neck wrong, which got worse. And by the next day I was in the ER. No, actually I went to a clinic. The next day I went to a doctor, next day ER, for several weeks back and forth between all these several meds, severe pain. The pain was really bad. And about August, September, a month later, with a lot of begging and a lot of crying and just being relentless and not giving up and explaining to them the pain I was in, I finally got in for an MRI, and that's when they discovered all these problems. Prior, 3 years ago to my surgery, they never did an MRI, and I wish they had done it then. Okay, so I have my list. Here's my list of things that I wanted to talk about that I just didn't know about. So you guys all have really good testimonies out there, and I learned a lot researching, so I do appreciate. I'm not saying that I have a better one, but I wanted to cover some things that I did not learn about. So I woke up from surgery and I had this eye was sticky. Like I couldn't close it. My eyelid would stick to the top, which I discovered they put tape over your eyes when you go to sleep, when they put you under, and this was not washing off with just soap and water. So they had to bring in oil base, I think it was like a baby oil, and that helped take it off. Also, the cough. Okay, so they're going in through your neck and they're moving all these cords aside, and you're gonna get a little cough. You also have a sore throat. So lozenges and cough drops were really nice. You don't want to suppress your cough too much though. I did vitamin C drops to suck on. The reason I didn't want to suppress my cough is because coming out of surgery, I really do want to work my lungs and cough and get them open. This was a big thing to me that I had never heard anything about, and it was really difficult. So when you're doing this spinal surgery on your spine, they put electrodes in your hair, and what they do is they pull your hair apart really tight and get like a good space of skin. And then they scrub it really hard. and they put a glue in it, and then they glue electrodes on your head. When you wake up, you have globs of glue and your hair is stuck everywhere, and it's hard to get out. So shampoo and water doesn't just get it out. So bring a fine-tooth comb and baby oil. It worked again. And work that out of your hair. The nurses said they've heard of people having to cut their hair. So yeah, be mindful that you want to get it out as soon as possible. I did a couple hours after surgery. My husband was already combing the oils through my hair and trying to get it out. Leg massage. Okay, when I woke up, I was on this machine that on my legs that was keeping good circulation throughout my body. And then I got home and I was laying in bed and I was, resting and not getting up or getting that circulation going. And so when I would stand, I would get, to me, I guess the best way to describe it, I would get uncontrollable like stretchies. Like I just had to stretch. And when you need to stretch, it's because you're not getting good oxygen, like good circulation through your body. And my legs were bad. So thankfully I have this machine that I bought from Bed Bath & Beyond. I'm going to come show you guys it. It's in my bedroom. It's kind of expensive. It's about $250. So not like an easy buy, but well worth it. And if you can get it, like just to have, like I bought it just because I'm a teacher and I want to have the massages when I get home. So this is what the machine looks like. I don't know if you can see it. Okay, so I'm gonna get in it and put my feet in and show you how it works. Okay, let's see if I got this going. All right, here's my feet. I'm gonna turn it on. It pushes down on my calves as well as my feet. There's little runners underneath my feet. And then it pushes, I should probably like lift my legs so you can really see what it's doing. Okay, hold on, here. There, let's see if that helps. See how it's squeezing and compressing up against my leg and my feet? And put it on a different cycle. Okay, so if you can get something like that, it's a really nice treat to have when you get off work and you come home and you've been sitting on your feet all day. But it's also worked real well after surgery. Okay, so apart from the leg massage, walk. My doctor said I couldn't lift things over 5 pounds. I couldn't bend over. I couldn't vacuum. I couldn't do a lot of just normal activities around the house. So I have a lot of help, thankfully, with the family pitching in and cleaning the house. But what's really, I think my dog is that my dog? Yeah. What's really important is to get up and walk. So I've been walking each night, and I'm going further and further and further, and I'm walking a little over a mile right now. I'm 3 weeks out of surgery. I would like to be walking a bit more. I take my puppy dog right there, Zariah. Hey, baby. There's my baby. There's my baby. She goes with me, my little partner. Hi, baby. Oh, yeah, there she is. Sure she is. And she protects me, and we go walking. Isn't she pretty? She's a pretty girl. So that's really helped me a lot. I find on the days that I'm not walking and I'm just getting up and watching TV that I do feel more tired and lethargic, and so it's important to get up and walk. Next thing, okay, pain. I was instantly out of pain after surgery. I know. I feel bad. I don't feel bad because I was in so much pain, but I feel so sad seeing so many testimonies where people are in worse pain or, in so much pain after surgery. And all the pain I had that was radiating down my arms and my fingers, they're still kind of numb and tingly, but instantly gone. The sore throat that everybody talks about, that's like supposed to be like strep throat, mine was very minimal, and was gone after a couple, 2 days. And every once in a while, I will tell you, I do get something. I get a slight pain in the back of my neck on the left side that radiates to like my lower base, like at the of my skull, like a headache on the back side. But it's really nothing bad. I've only had it 3 times, so not too bad. Yeah, my numb fingers. So I have numb fingers, these ones, but they're not as bad. One of the things that they told me to do was get a coin and put it, let me see, I might have a coin nearby. So you get a coin, and what you do is you place it on the countertop and you practice flipping it. That's all you have to do. So I don't have a quarter, which is much easier to do, but I'll just show you what they said to do. This is one of the things to help get back that feeling and work that muscle and that nerve. So here's, and I just do that. I know that seems so silly, but you'd be surprised how difficult that was at first because my fingers were so numb. So one of the things you want to practice if you're getting the numb fingers is flipping a coin. What else is there? Okay, I do have a weak swallow. I find that when I do need to take medicine, that's another thing. So post-op, I've barely taken any meds, but occasionally, like when I got that pain in the back of my neck that gave me the headache, I will want to take something, and I have a very weak swallow, so the pill gets stuck, and I'm having a hard time with that. So hopefully I can build that back up. I don't know if there's exercises to make that better. Hopefully that goes away. And okay, so my son knows I'm making this video, and he just did this to my dog and said, look, now the dog can be in the video. So here we go. Wait, what happened, Ranger? What happened? That's not nice, huh?
It's on that. He's like, please get it off.
Speaking of other neck braces, I'll share with you guys that. Okay, so I woke up originally in this one that he put on my puppy dog. This is the neck brace I woke up in. This is the one I was measured for prior to surgery. So, because this one wasn't at the hospital, they put this on me, which the doctor said was fine. And then they came and put this on and made sure the measurements and everything were good. So this is my main one. And then they gave me one to wear in the shower, this beautiful one that's waterproof. So I have these 3 neck braces, which I no longer have to wear this. And the best news ever, some of you are gonna be jealous. So I couldn't sleep at night and I couldn't really get much rest. So I'm allowed to take this off when I go to bed. I know you're jealous, I'm sorry. But my doctor said as long as I was just being still and not walking around and getting up and doing too much without it, that I was welcome to take it off to sleep. So now I'm getting a good night's sleep, which has really helped a lot. And I know some of you want to see my scar, huh? So here's what it looks like. I'll take it off. I'm exactly 3 weeks out. So, looks like somebody got a hold of me with a knife, which is what happened. But it's not too bad. It does have a lump to it. I don't know if your guys' had a lump, but mine has a big lump. It looks like a tube is in there, but it used to be longer. Like it's already shallowed out a bit. And she said as it heals, that swollen tube-looking thing will go down. So that's the damage. I think I covered everything. I'm sure there's other things I want to add to this. So if I think of something, I'll make another video. But for now, I'm 3 weeks out. I go back to work in 6 weeks. So I still have a couple more weeks to figure out things to do around the house. I'm doing crafts. I'm trying to keep busy. I'm walking. I'm having my son take me out to get out of the house, and just trying to figure out different things to do. So back to my brace and back to healing, and I go back to the doctor in a few weeks and I'll do an update then. Oh, that was the thing I was going to tell you guys. I go back on the 16th to find out if my bones are fusing. I have cadaver bone. So I have cadaver bone in me, and then I have the titanium plate and screws or whatever they do. So I'll go back and see if if all that's healing well, or if I need a bone stimulator or anything, which I doubt I do. So I believe in essential oils. I'm using those as well to help with the healing. Walking and just trying to do everything natural and healthy, and I bet I have a good report, so we'll see. All right, well, that's about it, and we'll talk to you later.